One.
We're going to be doing a bubble HE assessment on a postpartum patient today. Before the assessment, we would assist our patient in getting up and using the restroom if they needed to make the assessment more comfortable for them. This assessment is not only a hands-on assessment, it's also a lot of communicating with the patient, seeing this is a good time to see if they have any questions that need answered and how their emotional status is doing. So you would perform your hand hygiene, put on your gloves. You would identify your patient by their name, date of birth, and their wristband, their ID tag, and possibly MRN number. Make sure to explain to your patient what you're going to be doing. You're going to ask them how they're feeling. You're going to ask them how the breastfeeding is going, and you're going to explain that you're going to evaluate the breasts. Uncovering only one at a time, palpating around. You're looking for a change in temperature. You don't want them to be too hard, you don't want them to be red, you don't want them to be hot. You're going to evaluate the nipples at this time. Is there any inverted nipple? Is there any cracking happening on the areolas from the breastfeeding? It's a good time to discuss breastfeeding with them also. You're then going to go down and you're going to palpate the uterus. And we're going to say that she is just a few hours postpartum, the top of the fundus should be at the umbilicus or just below. If it feels boggy at this time, and at the same time, you can actually evaluate the bladder. One hand here, just above the pelvic symphysis. If you feel a distended bladder, ask your patient if they need to go to the restroom, if they can go pee, or if they've had difficulty with it. If your uterus is boggy, you can go ahead and perform a fundal massage at this time. You would now move down and you would check at this point, you can check all your lochia and make sure that there's no foul smell, check the amount, check the color. You can also check your episiotomy. If she's had one at this time, you may need to use a flashlight. You want to make sure that the edges are coming together nicely. There may be some swelling and some pain. It's a good time to change things and change the pad and offer an ice pack, which will make them more comfortable. You would also have your patient roll at this time, and you can check their hemorrhoids. And if those are uncomfortable, you can offer them some witch hazel or possibly get an order for a sitz bath. Now you're going to go down. You're looking at the legs, you're looking at the color of the skin, you're looking for edema, but one of the things you're going to perform on both legs is a Holman sign. Take your arm support underneath the knee, bring the toes towards the knee, and if there's any pain, this needs further evaluation and notification of the attending physician because there could be a embolism. The last part of this is throughout your thing, you're monitoring your patient's emotional status and making sure it's appropriate and that they are not falling into a postpartum depression or baby blues type situation, and answering any questions they have. You then return them to their upright position. Thank you.